Let's move on to the first session of the day, and it's about the digital future, because that is part of the transformation, and we know there's been a very significant move in that direction in recent years, and there is a lot still to be done. I want to bring up two speakers. We're going to hear from them for about 8 minutes each, and then we've about 10 or 15 minutes for some questions, and hopefully we'll get some from the floor as well. So can I invite up onto the stage Dan West, who's the Chief Digital Information Officer at the Department of Health here, and also Professor Sultan Mahmood, who's Director of Healthcare for BT. You're both very welcome. Dan, no stranger, of course, to conference, although it's been virtual over the last, so the whole digital thing has been tested and worked very well for us over the last 2 years. Nice to see you both. Dan, are you going to start first?
I think so.
You happy to do about 8 minutes? And then we'll hear from Sultan, and then we'll have a bit of a chat together. So the stage is yours.
Excellent. Good morning, everybody. It's absolutely brilliant to be here in person, and thank you to Heather and her team, and to Michael, the totemic leader who turns up and does the talking. So it's brilliant that we've managed to get this together this year, and thank you all. Before I do my 8 minutes or so of initial address, I wanted to share a reflection myself on yesterday's proceedings. And as for those of you who know me, you will realise I'm generally quite a sort of high energy, upbeat kind of individual. I found it quite hard during the course of yesterday to be optimistic. The big challenges that we were all talking about, how we will address together the financial position that we find ourselves in this year, and the winter that we're all collectively facing into. It did feel hard to maintain a kind of upbeat attitude. I know not everybody was able to make it to the dinner last night, but one thing that I found incredibly inspirational, and it kind of got me back on a fairly positive mindset, were the stories that colleagues told. We had Molly and Bill, Mark and Heather, that did a bit of a double act, and we invited a few people who had some recognition of their accomplishments over the course of the last 12 months or so, talk about their experiences, their stories, their contributions. And it really warmed my cockles, and it got me back onto a more positive and optimistic headspace. And what that showed me was the amazing group of people in this room and what they can achieve. So congratulations to all of you and to those individuals in particular. Before I start, again, I did want to make a slight correction in order not to disenfranchise somewhere between a third and a half of the people in the room. The title of this session is about healthcare, and I think we oughtn't forget that we are an integrated health and social care system, and therefore I'm going to talk equally about health and social care. So I will use some slides. I'm not sure everybody will be able to see them. It wouldn't be the normal approach for a presenter to ask everybody in the audience to get out their smartphones. It's a bit distracting, and as much as my narrative normally is fairly dull, let's be honest, I am going to ask you to get your smartphones out, which is a risk, and have a quick hover over this QR code. And the reason that I'm doing that is I'm really excited today to launch the Northern Ireland Health and Social Care Digital Vision and Strategy. It's been in development for 18 months or so. And we published it in May this year for a socialisation exercise. So that is an opportunity, having been somewhat inclusive in the creation of the strategy. We needed time as a group, collectively, after COVID, to think about what this strategy document says, and for people to get the opportunity to understand it and to comment on it and to provide feedback. So that's taken us from May until today. And I thought I would use the opportunity while I'm on stage to do the full formal launch. So here it is. Download it, take a look at it. The feedback that we've got during the engagement exercise that we've done over the last few months is that, and I'm characterising a little bit here, is that the strategy in what it says is fairly inarguable. We should get better at using data as a system. We should drive forward on our digital ambitions. And you heard it in the room yesterday morning from the Minister, from Peter, frankly, in most of the conversations that we've had over these 2 days, that digital and data is a really important part of where we're going. The concerns that we got from all of our stakeholders who we've spoken to thus far is, sounds great, Dan, but there's a lot going on. We're not absolutely certain we're going to be able to take this journey that you've set out for us. It's pretty ambitious, and deliverability, affordability, achievability are really big considerations. And what I thought I would do today is finish on that point. What are we going to do to respond to the feedback that we've got about deliverability? But first, for those of you who haven't had a chance to look at the strategy, I'm just going to do a little bit of an overview, just so there's a bit of familiarity in the room. People can go away and take what I say to you now and use that as part of your process to then understand yourself what we're saying, but also talk to your colleagues about it and provide feedback. While the socialization exercise is over, that doesn't mean that we are not taking feedback anymore. I know not all of you will be able to read all of these slides, so do feel free to download and take a look. So the vision that we have, trying to capture what this journey is about, what the time between now and 2030 is going to be in terms of modernisation and digitisation of health and social care services. So our strapline is making lives better for the people of Northern Ireland, using digital to transform the way we deliver health care and wellbeing services, being inclusive on all of our organisations and the services that they deliver to our citizens. So the mission has really got 5 key bits in it. So design, develop and deliver digital services, that's fine. Of course, I would say that, I'm the CDIO. But the key things are that those services that we deliver from a digital perspective support everyone to get the best care. They support our people, our staff at work, by streamlining information sharing across systems, and you can replace organisations for systems there, optimising the use of data and improving through that the safety, quality and experience of our services. So you'll see in the document there's this image, which it tries to just unpack a little bit of the vision that I've just set out there. And what it really tries to convey is that the technology itself is a means to an end, right? Technology for technology's sake isn't particularly useful. What we need to try to do collectively is foster a bit of a cultural change in the way that we see data and technology, and reimagine the relationship between the patient or client and their health and care team, and try through that to put people at the heart of everything that we do. Not that they're not already, but more as empowered partners in their health and care experiences, using the digital tools and data as the stimulus and opportunity to transform towards consistent ones for Northern Ireland services. Just flipping back 1 second, there are 8 aspects to how we've set out the vision. The first one is about leveraging data to drive insights, to create care journeys that are digitally enabled every step, not just in parts, to invest in world-class technology and deliver that technology and the benefits that it brings to us all through agile, adaptive and innovative working, to embrace the latest diagnostic and therapeutic technologies to deliver personalised care through streamlined processes to empowered, connected patients and clients. The next bit, which says some of the same things that I've already talked about here, is our strategic outcomes. So we've articulated these 6 strategic outcomes as a way of trying to encapsulate the work that we'll do. And I guess the important thing to understand that isn't visible in the strategy, but there's some supporting documentation that provides this, is that this isn't just vaporware that's going to sit on a shelf and get a bit dusty over the next few years. It's probably a reasonable observation that we've got quite a few strategies and reviews in health and care in Northern Ireland, and having another one that sits on the shelf probably isn't very much use. And what this is about is the energy that it's going to take to get to a different future in the next few years. So underlying this document and underlying these 6 strategic outcomes, there's 160 individual initiatives, and those 160 initiatives have been costed. Some of them costed with a reasonable amount of sophistication and fidelity in the way that we've gone about doing that. Some of them, there's a bit more of a t-shirt sizing approach to them at this stage, particularly those that are further out. And that big data set, the spreadsheet of death, as my team refer to it, that's what's driving the conversation that we're having about affordability and deliverability. I will show you another image just before I move on, which is the strategic framework. The strategy document isn't one thing. It is a master document with 90 pages. I'm not necessarily suggesting that everybody here would find it useful to read all of those 90 pages. But what we have is a structure that is then repeated through that main document and some child strategies that deal with some specific parts of the journey that we're seeking to take together. So the data strategy, for instance, that many of you might have already read, the innovation strategy, how do we create an innovation ecosystem and embrace and leverage the energy that there is in Northern Ireland to drive value for health and social care through digital innovation. And then finally, the cybersecurity strategy, because we're using data more, how do we do that in a way that maintains the privacy and security of the information that we hold as data controllers. So this structure that you can see, vision, mission, strategic outcomes, and then digital enablers and capabilities as supporting aspects of this journey that we're seeking to take, that structure is then riffed out through all of the strategies that we've developed. And it's just a common way of summarizing the journey that we're seeking to take and some of the why. So I would suggest to you all that it would be a fairly useful use of your time to maybe take a look through some of these documents. The bit that I wanted to just share before I hand over to Sul is reflecting on the feedback that we've got. It looks quite hard, Dan. There's a lot of work to do and we're all fairly busy. We're not sure that the journey that you're setting out for us here is achievable. And so what we're doing with that feedback is a further round of engagement for development of an implementation plan. And that implementation plan isn't something that's being developed in an ivory tower by the digital guys up in the department. It's something that's very much co-created with the system. And there's a few questions that we really need to reflect on as we go through that process of defining what is a more achievable journey. Setting out something that is unachievable and is too hard for us to do together, it is just going to make the current situation worse. So the questions, and there are just 7 examples here on screen that you can see, the questions that we want to reflect on with you and your teams is, do we have a coherent and deliverable body of strategic wide system change? So the department is asking the service to do a set of things. Is that set of things in itself, ignoring the digital question, is that deliverable? And do we need to do some prioritization collectively in order to deliver a wider achievable body of work? The digital portfolio itself, so thinking about all of the things that we're already doing, Encompass, NILIMS, NIPACS, DWP, all of those big programs that will deliver technology. How do we make that affordable? And how do we take what we've learned during COVID to work in a more agile way? How do we apply that to the portfolio going forward to create a good trajectory of technology investment? The trust side projects, so all of the trusts and their strategic priorities need to be reflected back as we're trying to develop a shared implementation plan so that it's not a centre out, but a collective view of what all the work is that we've got coming up over the course of the next few years. Workforce capacity and skills. It's been a constant through these last couple of days, workforce. So from a digital perspective, how are we going to build the capabilities that allow us to take this journey? How do we attract and retain and develop the right digital talent for us to be successful as a digital enabled healthcare sector? There's then the trust enablers. So it's a problem for all of us to leverage data better. There are particular teams in the trusts, for instance, the trust IT teams in HR, that are particularly burdened by this collection of programs and projects that the portfolio describes. So how are we going to work with those teams to try and liberate some of the capacity that they need to be able to take this journey? Thinking about BAU operations, it's great thinking about transformation. Our funding challenge this year means that transformation is going to be hard to afford. How do we focus in on our ability to continue to run our services safely? And then finally, the staff and their ability to adopt all of these systems and innovations in a way that's coherent for them and helps them to do their jobs better, rather than, frankly, just being a baffling set of new training and new tools that get deployed to them over the course of the next couple of years to try and create a coherent change journey for staff. So that implementation planning activity is underway. We will be continuing to do it with all of your organisations over the course of the next months. And that'll get us to the publishing of an implementation plan to realise the strategy that we've set out and launched here today in the coming months. Thank you very much for your time here. I'm going to hand on to Saul, who's going to talk to you for a bit, and then we'll have some questions.
Thanks, Anne. Good morning, conference. How are you feeling? Last week's audience was much better. How are you feeling? Very, very good. I'm Sultan Mahmood, Director of Healthcare for BT, and I've been here for a couple of days. And first of all, I want to thank Heather, Chair, for a wonderful conference. I think people coming together and really exchanging ideas and kind of a way forward after 2.5 years where we've all been cooped up is phenomenal. And I want to kind of share a bit about myself, but I want to start with a quote from Bevan, because I think the NHS will only survive as long as there are people who have the fight left in them to keep it going, and not just keep it going, but absolutely flourish. Now, I've paraphrased somewhat, but what I've seen here is a level of cohesion, a level of intent to kind of improve patient outcomes that I've not seen in any other ICSs, and I'm up and down the country and I've traveled globally around healthcare systems. I think genuinely this is the Goldilocks of healthcare. So I would say to the people here, you have got the social asset base to do perhaps what no other health economy can do anywhere in the world. And I've got 25 years of experience in healthcare. I've spent my career in primary care, secondary care, community care, social services, system regulation, system management, NHS England, you name it. I'm one of those lucky mongrels who's had access to all of the system. And, you know, it's really, really interesting where we are. So I talk about fight. Now, what's this fight? And I'll get into that. But a couple of really insightful people said, why the bloody hell are BT here? What have they got to do with healthcare? And it's a really good question. I'm really glad when people ask me. So hopefully in the next 3 or 4 slides, because I think the important bit is the conversation with Dan, to just give you an overview of where BT are kind of how we're trying to change the interpretive frame for the NHS and ourselves actually as a company who recognise we need to change to something more wholesome where we link purpose with our day-to-day business. You know, what do you do? I help people look after our friends and family. What do you do? I sell SIM cards. Yeah? You get the gist, right? Okay. So BT's vision and mission, if you like, you know, I always say to the company, let's begin with the end in mind. And we want to be the foremost trusted, innovative and effective partner to the NHS. And those words were chosen really carefully because trust is the fuel that kind of moves transformation. And some of the things I've seen between the trusts here, the social care system, the ambulance service, the primary care, I think trust is really good. I think it could be even better. So trust, for us as a company, we are working really hard to build trust in a way that's helpful to the NHS and social care. Innovative. So, you know, we recognise that we live in the 4th industrial revolution. Data is king. And innovation is absolutely needed because if we carry on doing what we are, the workforce challenges, you know, between 10 and 14% gaps, if you like, depending on who you ask, across the country, is not going to be fixed overnight. The demand exceeding supply, it's a really wicked problem because our multi-morbid population across the UK is not going away. And we all know that roughly 6.5% consume about 85% of NHS social care resources. It's that revolving door cohort. So how do we look at those people in an anticipatory way? And effective. I've spent many, many years on the other side where somebody turns up to my office and says, I've got the best thing since sliced bread. Do you want some? And unfortunately, the partnership between industry and the NHS has been hampered by that. There's a trust issue, there's a kind of we know best issue, and also, and let's be really honest, the NHS is not an easy customer to navigate. But actually, if you spend the time and effort, the NHS is a wonderful customer. So BT is having that end in mind. We want to be trusted, innovative, and effective. We want to do stuff that actually matters and counts. So our strategy, really simple strategy, 3 pieces, future-ready infrastructure. So as all of the things Dan talked about, and the 100 pages, Dan, Christ, 100 pages, yeah? Yeah, did a lot of things. 100 pages, it's going to require a new suite of infrastructure. So, systems are getting thirstier, and I call them gigabit thirsty. And we are setting up a suite of propositions across BT that is very, very specific to the NHS. We have over 1,000 years worth of experience of NHS operational, clinical, and strategic management, as well as technical management now recruited into the company to ensure that our offers back to the NHS are kind of customer-centric for the first time in roughly 10 years. So future-ready infrastructure is understanding your infrastructure to make it ready for the future, ready for your challenges, without the need to uproot, but to augment. The second bit of the strategy at the bottom is what we call customer-driven solutions, and that's really around the co-creation space. We have lots and lots of customers. We have over 500 NHS customers, and they all have similar challenges, but they're unique to their own prism of reference. And what we're trying to do with a select group of customers who are open to kind of co-create is create new solutions based on their instructions. That way, BT gets to kind of build something that's useful and gain credibility, but also the customer gets exactly what they need, as opposed to kind of what BT or anybody else wants to sell. And as Dan has said, the future is data, and the power of aggregator platforms, I think, is the future. So in an average English hospital, there are 350 to 360 data-generating units, from theatre systems to A&E systems to kind of PAS systems to point solutions that people are putting out in the community, monitoring patients in their own homes. All of it's generating data. Does that data join together to make sense? What do you think? I tell you, last week's audience was much better. What do you do? No. And it doesn't. And it's not for the want of trying. Yeah? But data connecting together, aggregating to make sense, yeah? And drive actual insight, drive the next best action is really important. I did on-call for 23 years almost. And at the weekend, you'll hit from anything from a drain blowing up in A&E to kind of 23 ambulances outside and the minister saying, what are you going to do about it? Yeah? And the way that the system runs, we have some brilliant innovation, but largely it's a bit helter-skelter. And we all know in other sectors, it seems a bit more organized. So how do we bridge that gap? And no one sussed it, but I think a community of people have sussed it. And it's kind of coalescing that thought leadership for scale and adoption across the country. So that's the broad kind of strokes of the strategy. Again, as we set off, the first thing I did, and many of the, I see Rasheen from the trust here, many of the colleagues will do this. Any big decisions are kind of really well thought through when they're clinically led. So everything we're doing, I've got a group of wonderful clinicians with, brilliant experience of IT implementation as well as kind of clinical transformation across the company. So, Professor Anne-Marie Canopy has worked across the globe. Dr. Giovanni, who's a former medical director in England. Your very own Michael Quinn, again, a brilliant informatician, but a jobbing nephrologist, but his systems thinking is second to none. And there's a group of people who've done some really interesting things, and their job is to be my moral compass, essentially. So anything we kind of bring out to the NHS makes sense, as opposed to kind of, it's got the best EBITDA position. Yeah? And that's a big shift for a company like BT. And again, what we are doing in terms of kind of building a digital strategy with a future-ready infrastructure is we're thinking about aggregation. So how do we aggregate services, infrastructure, partners, solutions in a way that works for you, that builds platforms for change? That's about working with ecosystems that are present and not uprooting them, which is what companies tend to do, and it's a big misstep. We're bridging the gaps between disparate systems. We're doing some really interesting work into our vanguards. Co-creation, I've mentioned, and actually kind of delivering technology that works into communities and hopefully into primary care and bridging the gap between primary care and secondary care. And again, the vanguard piece, and this is the last slide, I promise, the vanguard piece is about that co-creation space. It's about kind of an appreciative inquiry approach, understanding what's going on in a health economy or a trust, developing 2 or 3 use cases, and actually testing, refining, failing fast, and then developing. It came from the new care models idea that Sir Simon Stevens kind of put forward. Very similar approach. We have to test things that are slightly out there to see if they work. And if they work, there's kind of knowledge transfer across the system. In Northern Ireland, I'm pleased to say that Dan, his team, the health economy here is a key vanguard for us because we see a lot of cohesion here. We see a lot of thought leadership here. We see a lot of relationships here. And I think those are probably the most critical ingredients for success. And why Northern Ireland? I call it the Goldilocks. The system is cohesive. The operation and strategic layers work together in a way that I haven't seen elsewhere. And again, what potential that has. There's some real innovation happening here. Yesterday's award show, a colleague from a hospital, Paula, I think her name was, 383,000 people vaccinated as a result of social media. Where's that use case elsewhere? So you have some real champions here. The culture is really positive. I feel incredibly excited based on the conversation of the last 2 days around kind of the forward-lookingness of this economy. Digital maturity, the system is put in place with the Encompass program and the strategy, a level of technological maturity that perhaps will stand you in good stead for the next kind of 20 or 30 years, because care processes will be completely subverted, and I think you're getting ahead of the game. And I've mentioned Encompass. So I think you are the Goldilocks of the healthcare world, and BT are here to help, and help in the way that you think is fit. And I'll sit down now. Good morning.
Yeah, but that is not the end. There's another little bit where people might want to ask some questions and seek a little bit of clarification. It's very interesting. I suppose I was just thinking about not having been here at a real conference for 2 years. We've done the virtual conference, and things have changed so much. You said something that I was just separately writing down, which was about the challenge of understanding what's happening in the digital world. A lot of people are very nervous about it. A lot of people think, well, we have a system, we know how it works, I'm comfortable with it. Why do we need to keep changing things? But then when you actually look back on a couple of years, how effortlessly people have dealt with, for example, vaccine passports. I mean, we all have them on our phones. We all needed them if we wanted to go somewhere. That's just, people just had to deal with it. It was straightforward. They got on with it. And now it feels like an odd point even to have to make, doesn't it? Which from your point of view must be a good thing.
Yeah. So it is absolutely true that during COVID, everybody, be they citizens or staff members, embraced digital at a pace that was unimaginable as a technologist years ago. The reality, though, now is we don't have one unifying priority, which we did. We have 100 or more priorities. And from a staff member's perspective, in trying to cope with the pressure that the system is under, if all of our projects and programs that are delivering these new technical widgets reach out to staff and engage them and train them and bring them into how that technology product can help them to do their jobs better and for them to be able to operate at the top of their license, if that happens individually in silos, frankly, it's baffling. So what we need to do, and we haven't done yet, but we will, is stitch together the journey that we're on and describe the future state that we're trying to get to and why that's a good thing for everybody, in particular our staff members, and then describe the journey that we're taking in some coherent steps. And I think with that, our staff have shown that they are very reactive, very flexible, very resilient. And if we can describe a journey to them, I think they're happy to take it with us. Let's just try not to make it too baffling. That's my view.
Do you also have to prioritise? Because you cannot deliver everything for everyone at exactly the same time. So everybody in this room has a digital priority. I really wish that you would sort this particular issue out for me. But if everybody came up to you and told you what, you'd have a notebook full of priorities. How do you decide what gets onto page one?
There are some things that we have to do. There are some technological cliff edges coming up for us. We need to do Encompass because it replaces a bunch of systems that are too old to survive much longer. We need to do NIPACs and we need to do NILIMS. These are big clinical system transformations that we're doing. So that creates a bit of a foundational base upon which you can then make some prioritization decisions about what else you try to do and how much of that you try to do concurrently. And this implementation planning process, that we're doing at the moment will give us an opportunity to choreograph and sequence a logical, deliverable, achievable, affordable set of things that we can take to the service to drive benefit in a way that doesn't overburden people with change.
You're nodding, Sultan. You're very familiar with the conversation, obviously. Is it something you think that your company has to be an important part of and can help people like Dan to deliver on?
Yeah, I think I can speak for my company and probably a wider commercial sector as well. If you think about the narrative, so we all agree that the pandemic has accelerated digital delivery in healthcare settings between kind of 4 and 6 years is the general consensus. But it needed that, unifying force, if you like, that really burning platform. Other industries have got on with it quietly but progressively. So if you think about your bank, your building society, your other parts of your life are incredibly digitized. And the public expectation is, why isn't my healthcare service like that? To make this work, I think Dan's absolutely right, that there has to be a level of prioritization. But, I said about the good fight that Bevan talked about. The fight is attitudinal, yeah? Digital is not an adjunct. It's something we do when all the budgets are there. It is absolutely critical to meet the challenges. I mentioned workforce. We are all realizing the days of one-to-one care are gone. The days of one-to-many care is here. The power of data to do that exists. Systems around the world, Montefiore, New York State, Clalit in Israel, people are doing this. But I think in terms of priorities, Dan, I think across the sectors, there needs to be a level of orchestration to deliver this really complex strategy. And as far as strategies go, I can't, I've read it 3 times, I can't fault it. But what are you going to drop, and are you forgetting anybody is my question. Yeah?
Let's see who might like to ask a question from the floor. I see a hand right up in the middle, and we'll get Heather to get you the microphone. Thank you.
Hi, it's Anne O'Reilly. I'm here from the Social Care Council and Belfast Trust. I just wanted to ask, in the spirit of integrated care systems, is this going to widen out to, say, primary care? Is it going to widen out to the patient being able to operate smartly, no matter what part of the system they access? That's the first question. And the second question is, what about sort of the digital divide? Does that still exist, or has COVID settled that?
Okay, Anne, thank you very much. Dan, do you want to take those first?
Let me answer your first question really honestly. Our digital plan focuses a lot of its energy, and through that, a significant proportion of the money on secondary care. And I don't think that's right. I would like to do more in primary care. Interestingly, there's something, Ursula Mason referred to it briefly in her address yesterday. There's something that we might do with BT as a vanguard in Northern Ireland around primary care. What Encompass brings is a digital portal that allows patients to be galvanised in and part of the care continuum and interact in a digital way with their health and care professionals. So that's good, for sure, but that doesn't really embrace some of the opportunities that we've got in the way that we deliver community and primary care services. So we will do more. It's talked about in the strategy, but it's not in detail in the spreadsheet of death, and we'll get there. Digital divide's quite an interesting point. What we saw during COVID was there was no limit in elder demographics around adoption of digital technologies. They needed a bit more support, but it didn't diminish their ability to embrace and utilise those technologies. I think we do have an issue around rurality, though, so I don't think we have equity in digital access in a way that will allow everybody to embrace some of these tools, and I think we really need to think about it. And actually, interestingly, BT is an organisation that we could probably talk to a little bit about addressing that.
I think it's a really important question around parts of the system. I think primary care, we all know that 90% of care provided is done in primary care. We all know, certainly my experience in England, it's really difficult to get an appointment. The sentiment's changing, kind of British social attitude surveys around kind of primary care is kind of challenged now. And what we see is my primary care colleagues are working kind of day and night, end to end, as well as my secondary care colleagues and my community colleagues. But it's the same cohort of complex patients, they're called. It's a really important paper written by a chap called Wagner, 1988, and he kind of says, look, patients don't sit in these wonderful pathway diagrams that management consultants produce. Yeah? Dan, no dig, right? But they are multimorbid and they're erratic and they appear across the system. So the people that are causing us issues around demand and capacity are the same cohort of patients and citizens in social care and primary care. Primary care is incredibly important. We have the richest kind of data set in the world in terms of kind of primary care has been coding data since kind of the 90s. If we can link primary care to kind of some of our brilliant secondary care providers here in a way that's kind of meaningful, and it doesn't require organizational change, it just requires an attitudinal shift and a willingness to share data and improve access. We really need to start the process around kind of how we manage the logistics problem starting in primary care, getting people in the right lanes really, really quickly. So if you think about a GP practice, practices see 300 people, larger practices. That's kind of same as a DGH. And we always hear about the queues in A&E, but we don't tend to hear about the queues in primary care. Doctors haven't suddenly got lazy and said, oh, I can't do it anymore. They're really, really busy, but technology can really help this. And putting people in the right lanes and people operating at the top of their licenses around allied health professionals is a real answer. Linking that work to social care, some of the stuff that's going on globally around remote sensor technologies and what they can do with cohorts of people. Now, imagine, a clinician or a group of clinicians that collectively hold the risk but can manage Betty Smith across those three settings, social care, primary care, and secondary care, and then decide between ourselves, actually, it's best that Dan goes and sees Betty today because he can make, the sensors are saying this and the data saying this. Or actually, it might be, the practice nurse does it. So it's that kind of triumvirate working. I think the technology needs to enable that. And perhaps it can be an enabler for that in a way that it hasn't been before. You can use it as a catalyst for the actual service model change that we're looking for. So yeah, happy to help, Dan.
Can I just come back a bit on that? It's just, I suppose for me, it is about really deepening into the culture piece around how the system is organised and governed and accountable. And I do think it sounds like primary care has got enough of a deficit already. And then also we're just putting more into the secondary care system. And I am going away thinking, we've got to start thinking, go back further down the food chain for some of the solutions. And that's your primary care and your community care. But we're doggedly attached to the secondary care world.
Okay, Anne, thank you very much indeed. Look, I'm not going to get to everybody because we're virtually out of time. There's somebody with a microphone right back on the middle there on the right-hand side. I'll take it very quickly if you would.
Question from Seamus Mullen, Northern Ireland Ambulance Service, but the question's coming from a public health perspective, and Anne picked up part of it there. Just in terms of digitisation's obviously the way to go, but looking at after the pandemic, there was a piece of research carried out in Ireland this year actually, and bearing in mind our population profile and health inequalities here, what it showed was that residents in care homes, less than 60% of them have access to online services. People from travellers community, less than 25% have access, and people from black and ethnic minority groups, less than 40% have access to online services. So I just think we need to be mindful of that. It's another challenge in terms of quite often those population groups use our services the most.
Yeah.
So it's a significant challenge that hasn't really gone away after the pandemic.
It's a point well made. Do you want a quick word on that, Dan?
If you build systems that are only available on computers, you're dead right. There is an equity of access issue across a number of determinants. If you build access for smartphones, while you don't solve the problem, you make it a lot easier.
Yeah, absolutely.
Okay, final quick word, if you want to.
Just to reiterate what Dan said, so the digital divide is something that we're all mindful of. I drew my experience from something I kind of experienced firsthand in sub-Saharan Africa, where quite a lot of digital care happens, and it's probably kind of in a way that is profound. Dan has mentioned this already. If we can kind of get a lot of our access points and coordination and self-management for particular communities that you've mentioned into the mobile phone space, there is a lot that can be done. And myself and other companies, I think we've got a responsibility to kind of enable that. We certainly believe in our motto of connecting for good, and around access of data for communities. I think we need to look at that, Dan. But I think the mobile phone stuff is probably the biggest thing we could do quickly.
Okay, I'm sorry, folks, but we're out of time. And to be fair to the next session, we're going to need to move on. I know a few of you wanted to come in. I suggest that Dan and Sultan are going to be around for the morning, so nab them and have a chat with them directly. They'll be more than happy to have a word. And just to point out as well, all of the slides and information available from Dan and from everyone else, in fact, will be available from Nikon if you want them after the conference. So thank you very much to Sultan. Thank you very much indeed to Dan. And I'm going to hand over to